Hey, good afternoon. Thank you for joining us today on our briefing. We're joined by myself and Dr. Michael Mendoza. I'll start off with just a few thoughts and one announcement today that we have, and then I'll hand it over to Dr. Mendoza who can talk about what we're seeing in our numbers. I want to talk about what we think over the next couple of weeks and where we think the community is today and where I think we're going over the next few weeks, particularly as we're heading into the holiday season. I think about it like this. I think about the pandemic as I oftentimes think about life. You think about it as milestones. And I think about in the upcoming holiday season, Christmas. And if you think about it, the majority of people who are going to be sick on Christmas or would be sick this coming Christmas has probably not even been exposed to the virus yet, which means that we have all the power in our hands to control what the next several weeks and the next several months look like. It is up to us. It is up to how well we do to control the spread of the virus. And so what does that mean? It means we need to do our part. It means we have to flatten the curve. It means we have to wear our masks. We have to be physically distanced when we're together with groups of people. And we need to keep hand sanitizing and keep following the guidelines that are set out by the public health professionals. If we do that and we have a call to action amongst this community, we can flatten the curve. It's not too late. And we can save lives in our community. There's been some studies done, particularly by New York State and Georgia Tech, on what the transmission looks like. New York State recently said that 70% of all transmission of the virus is coming from small, unmasked gatherings. These are gatherings in our living rooms. These are gatherings in small, enclosed areas where we're not wearing masks. 70%. That is something that we all have in our power to fix. Based on our positivity rate, if we are in a group of 15 people, based on our rate in our region, in a gathering of 15 people, there's a 39% chance that somebody in that room may be sick. In a gathering of 20 people, it's 49%. So as we head into this holiday season, I would ask that we do this in a way that keeps and protects our loved ones and our friends safe. And we do that by wearing our masks and staying 6 feet apart at all times. I'd also like to point out that I don't think shaming is the right way to go. I know that there's oftentimes criticism when we see people get sick and you wonder, how did they get sick? Did they violate a rule? Did they violate a protocol? We need to support one another. We need to support those who are sick in our community. We need to support those that are facing challenges and help everybody we can with every way we can during these difficult times. No one intentionally contracts or spreads COVID-19. Applying shame or guilt to that is hurtful to the community. We need to support each other and realize we are all in this together. And we will get out of the pandemic together, hopefully in the next coming months. I do have one more announcement to make regarding Monroe County's response to COVID-19. Today, Monroe County has opened a decedent holding area, which is being managed by the County Office of Emergency Management. This is similar to the holding area that we needed to open in April, and this is a temporary structure that is necessary for a variety of resources and reasons, and is intended to be available in surge events. In addition to an increase in local deaths and fatalities related to COVID-19, funeral homes are limiting the number of funeral services they can conduct during this crisis to maintain social distancing and sanitizing measures. This has caused a delay. The current holding area provides a capacity of 20 decedents, and it is in place and ready for usage. Fortunately, we have not needed to use it yet, but with the growing numbers and the capacity that we have in the hospital systems, this unfortunately is a step that we have to take. So I would again just implore the community. We have the power in our hands to change the direction of the virus, to lower the curve, and we could do that by all working together, to know what works. And if you look through, I've said this 100 times and I want to say it again. If you look what we did earlier this year, it worked. If you look what the schools are doing, why are the schools safe? Why are the kids and the teachers and administrators not contracting and spreading the disease inside the building? It's because they're following the guidelines. That's where the proof is. The proof is in the pudding. If you wear your mask, keep a distance, and sanitize appropriately, we can stop the spread of COVID-19 in our community. And we'll do it working together. The vaccine is on the horizon. It'll be coming in just the next couple of days and weeks, the initial doses. I'll have Dr. Mendoza, we'll talk a little bit about that. But it's going to take some time before we get through this as a community. But the end is in sight. We now know what the end looks like. Okay, it's still months away, but at least now we know what it looks like. And if you think about the trajectory that the pandemic has taken, we can now see the finish line. We're about 3/4 of the way there. We can see it. Every race is won or lost in the last quarter mile. And that's where we are. Now is not the time to stumble. Now is the time to put our heads down, to redouble our efforts and get to the finish line and keep our families as healthy and safe as possible. So I'm going to turn it over now to Dr. Mendoza, who can give a little update on the numbers.
Thank you, County Executive Bello. As we look ahead to the vaccine and all the hope that it brings, I want to remind the public that we must not let our guard down. It will take time for the vaccine to reach our community in general, and we still need to take precautions as we brace ourselves for the colder months ahead and what I still anticipate will be an ongoing surge of COVID cases in the months to come. With the increase in numbers, and we will be reporting an additional 678 new cases today alone, we are working very hard to keep up with our isolation and quarantine work. We are hiring and training additional staff to keep up with the demand, and we are continuing to find ways to work harder and to be more efficient. But as these numbers continue to rise, we are finding that at times we are not always able to contact people as quickly as we would like. And so today I am asking the public for your assistance to help us with those critical first days after a new COVID diagnosis. First, remember that if you are feeling symptoms of COVID, please stay home, even if you think these are symptoms that might be consistent with another medical illness that you may have experienced in the past, like allergies. Second, remember that isolation applies to people with a known COVID infection, whether you had symptoms or not, and that the isolation period will last in general for 10 days. During that 10-day period, you should remain at home and isolate yourself from other people as much as possible. When you find out that you have COVID, you are very likely the first person to know. Your healthcare provider will not know, and very likely we in the health department will not yet know. So if you are feeling ill, I want to make sure that you contact your healthcare provider if you have any symptoms or any questions about your condition. Though thankfully, most people who have COVID will have symptoms that can be managed very safely at home. And while you are waiting for us to contact you, I am asking that you help us by trying to think of any of the contacts, starting with anyone with whom you might have interacted within the 48 hours before you began to have symptoms, or if you didn't have symptoms, within the 48 hours before your test was done. I encourage you, to the extent that you are comfortable, to inform these individuals of your infection so that they can take appropriate precautions too. Also notify your employers, your children's schools, etc., however you feel is appropriate. Those close contacts, those are the people that we want to inform as soon as possible so that they can be informed and make appropriate decisions about how to manage their own risk. Those people, again, will be the people who you were in contact with starting 48 hours before your symptoms began and who were within 6 feet of you for 15 minutes or more. The quarantine period will last 14 days because that's how long it takes in general for somebody who is exposed to the infection to potentially develop symptoms from the infection. And remember that a negative test during your quarantine period does not change your quarantine. And while we're on the topic of test results, remember that a negative test in general doesn't necessarily mean that you do not have the infection. Very commonly, people who test today may have been exposed yesterday and will not have enough of the COVID virus in them to register a positive test today, even though in 2 or 3 days they may have a positive test, all the while they may in fact be infectious to other people. So with that, I want to close by echoing what the county executive just said, which is that this is all within our control. Remember that the upcoming surge of the holidays that are coming up, those individuals have not yet been exposed to COVID. So this is still in our hands. So mask up for a friend. This isn't just about you. It's about keeping your friends safe and everyone they come into contact with after you leave safe. Spread out as much as you can and keep your gatherings low key. Keep them small. Don't let your guard down, and especially don't let your guard down just because you're in a group of people who you think you know well. With all of these steps, I know we can do this. We've done it before. The end is near. The hope is here. And we all need to keep working together to get through this pandemic safely. So with that, I want to turn it back over to the county executive and to Julie for questions.
Okay, we're going to start with Noelle Evans from WXXI.
Hiya, thanks so much. And just to start, I wanted to focus a bit on numbers and clarifying some of the things that I'm seeing from residents on social media. There seems to be some confusion if people who have tested initially for COVID and then later retest positive, if those are contributing to daily numbers. And when it comes to active cases, if this includes presumed positives or if that's specifically those who have tested positive.
So all of our case counts are only people who have positive test results, so confirmed test results. Those people who we might presume, based on their symptoms and their history, we would certainly treat from an isolation and quarantine standpoint as though they're positive. They are not included in our positive test results. And remind me what the beginning of your question was?
Sorry. And so that was active cases you were talking about. People who are retesting positive, is that contributing to daily numbers?
Yeah, that's a very small number. So when you look at the state reports, that is all tests. And they don't take out people who have tested multiple times. In general, somebody who has tested positive, we don't recommend that they test again for at least 3 months because it's not going to change anything. But people who test negative, we certainly want to encourage them to continue to get tested as appropriate. And every one of those tests will be included, even if it's a repeat test on the same individual.
Thank you. And then just to follow up, I recall from last week, the death report that came out was actually from November. And I'm wondering if this is a sign, if some death tolls are coming in late, if this is a sign that the public health department is struggling to keep up.
No, I mean, we're certainly challenged in a lot of ways with keeping up with the numbers, but the death reports come into us from a variety of sources. When a death occurs in the hospital, we'll typically know about it very quickly. But for the deaths that don't occur in a hospital, in-home deaths, for example, we're not routinely notified of those. And so we'll report those as they come through the usual vital records process. And so that's the reason for what looks like a delay in some cases.
Thanks, Noelle. Dan Schreck from 13 WHAM, you're next.
Good afternoon. Thank you all for having us here this week. So first question, I suppose, is for Dr. Mendoza. With the number of vaccines that are slated to come to the Finger Lakes region, 11,150, is that 11,150 doses, meaning 11,150 people will be given the first round of vaccine? Or are we talking 575 people are going to be vaccinated and the remaining doses will be re-administered 21 days later?
So as I understand it, that 11,000 number refers to the number of doses. And so half of that essentially will be the number of people that will be included in this first wave. Now, we don't know the cadence at which these incoming shipments will occur. And so I anticipate that once we get through this first round, if the vaccine arrives in this area next week, my assumption is that we'll go through that supply within a week. And we'll anticipate the second half of that shipment coming within 3 weeks. But that doesn't mean that we're not going to get something in between. We just don't know yet. But the allocation at this point is in terms of 2 doses per person. And so that 11,000 and change will refer to roughly 5,000 individuals.
Okay. And then my second question may be more suited for the county executive. Earlier this week, Governor Cuomo alluded to the fact that he was going to announce zoning changes. I'm wondering if either of you actually have any insight into what those changes could potentially be. Are we talking about possibly lifting some of the restrictions we're currently seeing in orange zones, or what?
Yeah, no, Dan, that's a good question. So he did indicate that those changes are coming, and I would expect those to be done in the next couple of days. So I'll be paying close attention to what gets announced tomorrow and again over the weekend. So I'd expect that any day now. What they had laid out was essentially that after Thanksgiving that really what you need to do here is figure out what's the post-Thanksgiving strategy. What's to wait 14, and the strategy was to wait 14 days after Thanksgiving to see what were the numbers doing, where is the spread occurring, and do we continue to see the increasing in numbers? And we do have that. And that has to also then be balanced against the concerns that we have around geographic boundaries. The governor acknowledged that. And the challenge about how do you zero in on cases where they're spreading, but also have a modicum of fairness to it. And that, you know, I hear from business owners a lot where, you know, you have a barber shop or a salon operating on one side of the street, but it's closed just down the street or across the street. And so you have to weigh those two challenges. And so I think that's what the state's looking at now. They also added the hospitalization rates as part of the metric that they're looking at. But one thing message that I have to the community, and I know is part of the conversations here, is that because 70% of the spread is happening essentially in our living rooms, it's happening in these small unmasked gatherings. You can't really you can't just shut down your way out of it. That's only a piece of it, right? Limiting what people can do outside of their home, it really is just only a piece of it. We really have to work together as a community and have a coming together to figure out how can we support one another and still be social beings. We are social beings. We want to be together. We want to be part of the community. How do we do that in a way that keeps us safe? How do we encourage each other to wear masks, even though you're in a friend's living room and you think it's safe and you think, well, my friend can't get me sick? Well, sure they can. How do you encourage someone to wear a mask? How do you use Zoom sessions more effectively? How do we celebrate the holidays, right? Hanukkah and Christmas here. How do we do that in a way where we can still connect with our families, but still do so safely? So that has to be part of the conversation here as well. So, you know, to get back to your original question, I don't know what the answer is. I suspect we'll know that soon, what those adjustments, but I do know adjustments are coming. And we'll see what those are. But those are all the different factors that I think are going to play into what those boundaries are and then what those restrictions might be.
Thanks, Dan. Mary McCombs from Spectrum, you're up.
Thank you so much. Good afternoon. And once again, thanks for taking our questions this afternoon. I wanted to kind of talk a little bit about the governor's decision today. I'm not sure if somebody would care to address this, not to include EMS workers in phase 1 for the vaccine distribution.
Well, I'll start by saying I'm surprised by that. I think that's largely a statement more of the capacity of current vaccine supply and, you know, obviously trying to pick between two high priority categories. I will say that I do think the ICU and people in the ICU and the nurses and the people who serve food in the ICU, all the people that work in the ICU with known COVID positive people are more high risk than, you know, in a typical ambulance where you are likely to find a COVID positive, but not as likely as a known confirmed person who is very ill in the ICU. So while I can appreciate the, you know, the feeling that the EMS professionals are, you know, feeling left out, I understand that. I was frankly surprised by this, but I do think in the end, we do have to make these determinations. My ICU colleagues will be ahead of us in primary care, for example, when I saw patients this morning who had COVID. So, you know, we've got to make difficult decisions, but I do think that in time, as long as we still continue to take our precautions, we'll come out okay as a community.
And I guess my second question would be, if you could expand a little bit more, I heard you last night mention a little bit about the bubble theory and that false sense of security. We're talking about the holidays and we're talking about people who still may believe within their own family that they are safe. What's the message that you want to get out there as we do get closer to Christmas?
Well, so on the notion of the bubble, you know, I think it doesn't take very much to appreciate that even though you might be trying to do everything you can to control your environment, you know, we really can't control what other people in their environment are doing for themselves. And so, you know, you can see very clearly how quickly how your bubble can expand. But I think it's a good way to start thinking about the notion of risk. It's a good way to think about, you know, what can you control, and having those conversations with those that you are in contact with to try to encourage them to do the same thing. And none of these interventions is perfect. Masking isn't perfect. Distancing isn't perfect. None of these things is 100%. And that's just the way life is. But if we can add up all of these precautions, the cumulative impact of them can be very, very effective. And so I think my message to everybody is to be very thoughtful, to engage in as many of these precautions as possible, as often as possible. And in that way, I think we will come out ahead at the end of this. But I've always worried about that false sense of security, whether it comes from any of these interventions that we're suggesting, as well as the notion of trying to contain your bubble, if you will.
Okay, thank you, Doctor.
Thanks, Mary. Brian Sharp from the Democrat and Chronicle, you're next.
Thank you. Dr. Mendoza, I just wanted to follow up. You had mentioned some delay in being able to contact COVID positive folks and do the tracing. Can you elaborate a little bit on that as far as how long is that delay, and is that a matter of staffing?
So the delay happens in phases. And so some of those delays occur within the health department, and some of them are outside the health department. And so, I want to take responsibility for what we can do here in the health department. Obviously, when there's a delay in the lab and the patient doesn't get the test result as quickly as possible, that's a delay that's out of most of our control. But when the positive result comes in, there's always a natural delay, and there always has been, from getting that result from the lab into the state system, and then from the state system to us. Because of the surge in cases across the state, that process is taking upwards of 2 days, if not longer in some instances. And so then when we get the results, we've got to go through the process of verifying residents and making sure that the result is in fact a positive result. And so that verification process takes us more time. And then we have to assign all of the new individuals to case investigators, who will then reach out to these individuals to talk to them about what's going on. Now, in most cases, when we call somebody, almost everybody knows that they have a positive result. And so while they're waiting to hear from us, we don't want to delay in taking all of those initial steps, because it's that initial 24 to 48 hours, which is so critical to informing those contacts to that first person who's positive, to inform the contacts to isolate. So, in general, there isn't really a general delay. It tends to vary based on weekends and how many people are on staff and so forth. So it isn't a growing delay over the last week or two. It grows, and then we catch up, and then it grows a little bit more. And then, overall, we've kept it pretty stable. But, we have to plan ahead, and we're hiring more people. We're training more people. That takes time. But at the end of the day, we want to do the right thing for the public. And so that's why we're asking for the public to step in, particularly in those first 24 to 48 hours, to identify and inform those contacts.
Thank you. And I was just wondering if you could speak to a little bit about how soon, given, I think you had said, if it's 5,000 and some this first round of vaccine, how soon will we be able to get, until we'll be able to get to the nursing home population and get to them in a meaningful way?
Well, the nursing home population is being handled in a different way at the state level. So the governor talked about the collaboration with pharmacies, and it will be the pharmacies who will be working directly with the nursing home population, both the nursing home residents as well as their staff. So I can't speak to the delays on that, on the details of that process. I'm not aware of that part of the process, but that is my intention. My anticipation is that they will be up there with Tier 1A, just like everybody else that we're talking about in the hospital.
Thanks, Brian. Looks like we have Akia Collins here from WROC.
Good afternoon. I guess my question is similar to what Dan asked earlier, but we're also seeing from the New York State Restaurant Association that they're preparing for a shutdown. This might be for Mr. Bello here, this question. I was wondering if you are anticipating a shutdown anytime within the next week or so.
It's hard to say. It's the metrics that were laid out right now is related to the hospitalization rate and what the capacity is in the hospitals as it comes to restaurants. So I believe in New York City, restaurants were limited to takeout only right now, and then in areas outside of New York City, they're going to tie whether or not you can keep businesses like restaurants open to how full the hospitals are, what the capacity is. So if they had asked the local hospitals to surge by 25%, their capacity, which our local hospitals have more than done that, to prepare for what might be coming. And then if you hit 90% of the, or if you're starting to trend, your hospitalization numbers and rates start to trend in a direction where you're about 3 weeks out from hitting that 90% threshold, that's when things start to slow down. So how the state calculates that, I'm hoping as part of the announcement coming up, we are in constant contact with our hospital staff. Dr. Mendoza and I meet with the state and our hospital systems 3 times a week. We've convened these calls, just like we did earlier this year, to make sure there's that collaboration, particularly to give leaders here confidence in the surge capacity, and that the hospitals have the capacity to handle the numbers that we have right now, so that we can then describe and be able to relay that confidence to the public as well. And I have a lot of confidence in our healthcare systems. They're working incredibly hard, but that's going to be my understanding, the new metric, particularly as it relates to restaurants.
And then just a follow-up question for Dr. Mendoza. Governor Cuomo talked a lot about reaching out to the Black and minority populations and neighborhoods within our community and making sure they have equal access to the vaccine. I'm wondering, from your standpoint, from a county standpoint, what efforts or educational outreach programs are you guys going to be looking into?
Well, thankfully, we've got a lot of work already happening in our community, and so we are not going to reinvent the wheel on this. We've got a lot of existing relationships across our community, trying to ensure that we've got social justice across a multitude of different issues. And so we're going to piggyback on all of those efforts to ensure that we have the same level of success and then some with regard to this vaccine and its deployment. In the initial stages, it matters. We need to do a good job of ensuring that we have equity in the distribution of this vaccine, even within Tier 1A. And so when we look in the ICU, we're not just going to pick people with certain credentials and certain titles. We're going to go based on risk. And that means everybody who goes into the ICU is at greater risk, frankly, than most people in the community. And so we're going to look at everybody, from the ICU attending to the nurses, to the people who deliver food and transport patients around the hospital. All of these individuals are at high risk. And so communication is important. So we're going to communicate the various tiers as they are developed and announced by the state. And we want to make sure everybody is clear on those criteria so that there isn't confusion and so that people can ask questions if there are areas where there isn't clarity. Because here in the health department, we want to take responsibility for this. We want to make sure that we do this appropriately. And so if there are questions, we want them, and we want to have the opportunity to clarify whenever we can.
Thank you all.
Patty Singer from Minority Reporter is up next.
Oh, thank you. We heard the phrase false sense of security and finish line is in sight. How is this talk of vaccine, imminent vaccine, possibly affecting people to not wear masks, to not follow guidelines? Because all this talk people may interpreting is that the vaccine is going to be here, I will get it, I don't need to do any of this. So are we hurting ourselves by talking up vaccine so much?
Well, Patty, in my view, it's a double-edged sword, because we have to be open, honest, transparent, and we have to educate about the vaccine. And I think, though, that when we talk about the end is in sight, you have to talk about it as this, is that we know there's a vaccine. The vaccine is coming, but there's still time before it gets here. And so that's why we have to be honest about and talk about when the vaccine arrives, what are the phases that it will come in. When we don't yet even know how much will come in these batches as they come over the next several weeks, the next several months. But what I'm trying to do, and I think the point behind even talking about it, though, is to really try to fight this COVID fatigue. We have pandemic fatigue. We all do. Nobody really wants to do this anymore. I understand that. I don't want to wear my mask anymore, just like you don't. My kids don't want to wear masks in schools, just like all the kids who are at school right now don't want to wear their mask either. But we have to. And, I think about it, like I said, I use the analogy of a race. We're not at the finish line yet, but we're about 3/4 of the way there, right? We can see the finish line. We know there is one. We know that it's on the horizon, but we also know that all races are won or lost in that last quarter mile. So we have to keep our head down. We have to re-energize ourselves and recommit ourselves to this, because we know that one day this will be over. We do know one day we will get through this. And so I'm hoping, in the other senses, I'm an optimist. So I'm hoping that we can motivate our fellow residents to work together to get to that point where we can all be vaccinated and we can get back to life as we used to know it.
And I will add that, with the vaccine on the horizon, we have a lot of work to do to educate the public about all the uncertainties around this vaccine. Not only is it new, not only is it a technology that has not been used widely in virology to date, many parts of our community are very justified in having questions and uncertainties about this. And so I think, to the extent that we can be transparent and honest early, the vaccine is coming. There's no sugarcoating that. We're excited about that. But we want to educate the community so that we are prepared to reach what we hope will be a high immunization rate. Because if we have a high immunization rate, we can reach herd immunity, which ultimately means protection for all of us. And so that is ultimately the goal.
As a follow-up, I want to talk about schools for a second. We've heard that schools have not been the problem. There hasn't been transmission in schools, but on the daily reports, there, even before Thanksgiving, there were numbers in the dozens and up to sometimes 40, 50 a day in the 10 to 19 age group. Where do you see that age group contracting this if the schools are being said that it's not school transmission?
They're contracting it outside the schools. Our students in our schools are also students in our community, and they are at risk when they are not in school, and they are at risk when they are in their homes, when we as parents have gatherings larger than we should, and when we don't take precautions in our homes, and when we have gatherings with people that we haven't seen in a long time. And so the point of my message is that we as parents have a responsibility to our kids, both to them and to their schools, to keep them open. But again, we have not seen very many examples at all of in-school transmission. And our kids are part of our community, and we in the community are spreading it to our kids outside of school.
Thank you.
All right, Jennifer Lukey, you're next from WHEC.
I knew it was my turn, last but not least. Dr. Mendoza, I wanted to talk about contact tracing a little bit. I'm wondering, I know I asked you this question several weeks ago, but I'm wondering, since the Thanksgiving surge, since we've come so far, have you or your contact tracers traced anything back to salons or barbershops or gyms? And when it comes to indoor dining, the governor seemed to suggest yesterday that that's the growing number of where transmission is coming from. Are we seeing that here locally as well?
So gyms, fitness centers, barbershops, and salons continue to be areas where we are not seeing any evidence of significant spread. And as I think about this, I think of these types of interactions as being very safe because people are generally wearing their masks and taking their precautions. When I think of hair salons and barbershops, obviously the work is very different, but the nature of the interaction is not all that different from going to a dentist or to an eye doctor. You've got very close contact for prolonged periods of time. And we've shown throughout this community that even in those relatively higher risk types of interactions, we can take our precautions and do so safely. Now, we have seen examples of transmission in bars and in restaurants. And I think the unifying factor there is that you can't wear your mask as readily when you're in a bar or in a restaurant. And so we are seeing examples in restaurants, and it is harder because with the increase in prevalence in the community, when we call individuals and we try to figure out where they got it, they'll give us 3 or 4 examples of interactions where all of the people in those interactions had COVID. And so it's really impossible to know where they got it among each of these 4 high-risk situations. But we have been seeing it in bars and restaurants. And so, I think, restaurants and bars are more risky than gyms, fitness centers, hair salons, and barbershops. But that being said, I think our restaurants have done a good job so far, given how many, meals have been eaten in restaurants and bars since the beginning of this pandemic. We haven't actually seen that many. But as the prevalence goes up, the risk goes up. And so I think it makes sense to follow the data and take the precautions that are based upon the data.
And County Executive Bello, following up on that, based on what Dr. Mendoza just said, are you advocating to the state to pull out the barbershops, the salons, the fitness centers from the orange zone, if there even is an orange zone come tomorrow?
What I've been advocating for is that there be some thought put into the equity of how that works, and that it be backed up by data, whatever the closures are. So to make sure that whenever anything is closed or part of that closure, it's backed up by the data, it's backed up by the metrics, but that there's also consideration to the geographic boundaries of where the clusters are. Because I am sensitive to the fact that, you know, even though you have to have a boundary, everything has a boundary, right? When you're drawing on a map and you're trying to get into a cluster or a county or a town or a village or state or city, there has to be a line somewhere that there is an inherent unfairness between my business is closed here, but it's open here. So I think that's the direction we're going in. And I also would like to underscore too that I think the hospitalization number, I'm looking at that as a rate, is correct as well, because that's really the true measure of the health of the community, right? I mean, because the number of positive tests that you get is also related to the amount of testing that you can do, and vice versa. But the hospitals, at the end of the day, you know, we're really trying to avoid overwhelming the healthcare systems, and lowering the spread there. So we'll see what the announcements are tomorrow. But we really want to make sure, and I think the governor laid that out as well, and I think agrees with this, and so does the state, that you know, they're looking at the data, and that's why this is such a challenge, by the way, is because 70% of the cases are essentially being spread in our living rooms. And so how, you know, that's the challenge that we have as a community that we need to come together and deal with and acknowledge, is that if 70% is happening in our living rooms, how do we fix that? You can't enforce your way out of that. You can't shut down your way completely out of that. That's not going to fix that. So we have to just continuously keep hammering home this message that we have to be safe. We have to think about risks. How do you mitigate your risks? And how do you understand that even if you're with friends or family in your living room, you have to wear a mask, or you have to stay 6 feet apart. You have to take those factors and understand that anybody around you could be carrying the disease. Sorry, that was a long answer to a short question. All right, was that?
No, we have one more. I'm sorry. Gino Finelli from City Newspaper.
Hi, Gino.
Hi, how you doing? So I wanted to ask, is there any sense yet of what kind of critical mass of people need to be vaccinated before we can start going back to normal, in some sense of, you know, not being required to social distance and things of that nature?
Well, you know, it's going to be a gradual process, and, you know, I don't want us to let down our guard too early. So from my standpoint, I want to communicate that we need to keep all of these precautions going as long as possible, because if we let down our guard too early, if let's say 20% of the population is immunized, well, that's still, you know, 75% of the population who is still susceptible, and that's a lot of people. So we want to encourage people to resist the temptation to resume normal too early, and I get it. I'm with you. I want normal too, but we really run the risk of setting ourselves back by letting go of the reins too early, if you will. So it really depends on how quickly we are able to get the vaccine here in the county and how quickly we are at deploying it. And this will be among the largest public health undertakings of our generation to provide an immunization to 700,000 individuals here in Monroe County alone. This will be unlike anything we've ever done. And so Julie just reminded me that I might have misspoken about the numbers of the vaccines coming to our area, if that refers to doses or people. So we will clarify that and we'll get that back out to you. So I apologize for that.
Gotcha. And just one other thing, this has been addressed before, but I want to talk about refrigeration for vaccines. Obviously, these things need to be kept extremely cold. How has that process been of building that infrastructure there, of having the equipment there to keep these things, you know, cold and able to be used?
So part of the reason why the initial shipments are relatively small is to give all of us in the community, and to begin with in the health care system and hospitals in particular, the opportunity to sort of test everything out, to not just test the technology, which is the easy part, but to test all the workflows, all the different ways that all of the staff in the hospital have to work together to get this thing done. Because this is a very complicated vaccine. It's unlike any other vaccine that we give in our offices today. So while the refrigeration is only available currently at our hospital systems, that doesn't mean that we will only be able to give the vaccine in hospitals. There are protocols that are being developed that will stipulate if you open the box, for example, you have a certain number of hours to get it to an office. So, you know, if you think it through, there are ways that we can administer the vaccine outside of the hospital. And we're going to have to. There's no way we're going to vaccinate our entire county within the four walls of a hospital building. So we do have time, but we are looking at the initial rounds here as a way of making sure we fine tune our processes to make sure that we do this efficiently and in a way that's not wasteful. So more to come on this, but there's a lot of work ongoing on this very complicated task.
Okay, County
Thank you.
Executive. Thank you.
Okay, great. Thank you all for joining us again today. One of the things, last message I'll just leave you again, I'll just reiterate as we head into the holiday season here. Every day is a day that we can keep our community healthier as we get into the holiday season, and the actions that we take today, the steps that we take to mitigate the spread of this disease will impact the health of this community 2 weeks from now, 3 weeks now, 4 weeks from now. So we have the power within our hands. And let's also keep our small businesses in mind as we enter this season as well. A lot of them are struggling. An awful lot of small businesses, restaurants that are still open and open for takeout are struggling. And we need to be mindful of our small businesses. And please, please keep them in mind while you're doing your Christmas shopping and holiday shopping this year. So thank you, and we'll see you again next week.
Thanks, everyone.
Everybody.